What causes tinnitus ringing in your ears? Imagine hearing a constant ringing or buzzing that no one else can hear. That's what many people experience with tinnitus, a common symptom rather than a disease itself. Tinnitus often signals that something is affecting your hearing system. Most frequently, it is linked to changes in how your ear and brain process sound, especially when there is damage to the tiny structures involved in hearing. The main origin of tinnitus is usually in the inner ear, specifically in a part called the cochlea. The cochlea is a spiral-shaped structure that turns sound waves into electrical signals sent to the brain. Inside the cochlea are tiny hair cells that move when sound hits them. When these hair cells are damaged, due to loud noises, aging, or other factors, they can send random signals to the brain even when no sound is present. The brain interprets these signals as noise, which is why you hear ringing, buzzing, or hissing. Hearing loss is a common cause of tinnitus. As people get older or are exposed to loud noises over time, these hair cells can become bent, broken, or die. This damage reduces normal hearing ability and can lead to both hearing loss and tinnitus. To compensate for less input from the ear, the brain may increase its sensitivity to sound, which can make the internal noise more noticeable and bothersome. Other factors related to hearing loss that can cause or worsen tinnitus include ear infections, buildup of earwax, and certain medications that are toxic to the ear, known as ototoxic drugs. Medical conditions like Meniere's disease, which affects the inner ear and balance, can also cause tinnitus. In rare cases, issues with blood vessels or muscles near the ear may be involved, but these are less common causes. Tinnitus can also originate from problems anywhere along the auditory pathway, from the outer ear to the brain. For example, a blockage in the ear canal from wax buildup can change pressure and make internal sounds more noticeable. Head or neck injuries can also impact the auditory system and trigger tinnitus, often affecting just one ear. While scientists are still studying the exact mechanisms, the consensus is that tinnitus results from a complex interaction between physical changes in the ear and how the brain processes sound. Most cases are subjective, meaning only the person experiencing it can hear the noise. Objective tinnitus, which can be heard by others, is rare and usually caused by muscle spasms or blood vessel issues. In summary, tinnitus is most often caused by damage to the hair cells in the inner ear, which disrupts normal sound signals. The brain then tries to make sense of this altered input, leading to the perception of ringing or buzzing. Other ear problems, medications, and medical conditions can also contribute. Because tinnitus can have many causes, anyone experiencing persistent or bothersome ringing should see a healthcare professional for proper evaluation and management. Remember, understanding the root cause is key to finding the best way to manage or reduce tinnitus symptoms.